Hello and welcome to Clinician Development. I'm your host, Peter Tran, joined by my coaching colleagues, Brad Fern and Sue Kiernan. We're three professional developmental coaches who interview physicians about the mental demands of their work and industry. In this podcast, we also share our insights on how coaching process can support more complex thinking and solution building in healthcare. In today's episode, Brad interviews Minneapolis internist Dr. Scott Nelson about how developmental coaches can support physicians during the COVID-19 crisis.
Scott, can you say a little bit more about how the emotional psychological experience, as you know, obviously I'm not a medical person. What's it like in the hospital for you and your colleagues? And I know you can't speak for everyone, but give us a kind of a window in emotionally, fear, anger. What are you experiencing?
Yeah, I think it's best way to talk about that is to kind of follow the timeline a little bit of how the whole situation developed. And as we've talked about, I think there was at first apprehension, but mixed with a lot of spirit and a lot of group cohesion spirit. And colleagues independently were talking about how this felt like sort of an anti-burnout moment. And this was around the time of the national emergency being declared. And I hadn't thought about this before, but that was really the last time all of the doctors, we had a big hospital-wide meeting of physicians, surgeons, all various doctors, nurse practitioners, PAs, and residents, and we were all in one large meeting room together or auditorium together. And that was the last time that we did that, of course. We would never, that doesn't even come into question now, of course. So things got really real at that time, or things were like sort of confirmed that they are real right now. So there was this anti-burnout feeling, this kind of elan, almost a joviality a little bit, people getting ready for this.
And what's happening is that all of a sudden, boy, we've got our purpose and we're moving forward with what we're here to do type thing, or?
Yeah, I think that was part of the burnout, the anti-burnout discussions at the time, is that now we're here, we're internists, we're hospitalists, and we're the physicians who are going to have to deal with this, along with the emergency room colleagues and the intensive care unit colleagues and other groups like the nurses. We're the ones that are going to face this thing, or lead in this thing. No other specialist groups would. I mean, obviously infectious diseases and things like that, but the specialist groups would be kind of taking a second fiddle, So I think there was sort of a pride of profession at the moment too that people were feeling, that was just kind of gotten, it was a different situation, the everything about the medical moment depended on us. So it kind of did feel, I think there was a sense of heaviness about that, but also kind of a pride of profession and energizing aspect to it too, along with apprehension. Those things slip more and more in, of course, become more real as the situation changes in the hospital, on the floor.
Scott, in my world, the coaching world, people have a very sincere, the coaches, and I would argue probably the psychotherapists and things like that, have a very sincere desire to help. And but what I can see happening to some degree is there's almost kind of like a presumption that we know how you're experiencing it emotionally and psychologically. So if you were coaching the coaches,
yeah,
what would you advise them about moving forward? I see several organizations are offering free coaching, things like that.
Yeah.
What would be the best help, or how would you advise coaches to see this thing?
Boy, that's a really good question. I would I would only like confirm, I think that I feel like there is a perception, uh, when being addressed by you, like my profession being addressed by your profession. I think you're right. I think there is some feeling on our side of things that, uh, how did you say it? That, there's a presumption, how these things are. You're kind of looking at it from up here.
Hmm.
Uh, and then I think there's a bit of, I don't know, insulted, not insulted, but maybe the put off or something. Um, and I would only say to that, uh, I don't necessarily, certainly in talking with you and in our multiple discussions now, I've never felt that with you. I don't feel like you as a coach are coming across as somebody who,
Is it,
is doing this.
is it kind of a patronizing feeling, or just kind of a?
Maybe a bit of a patronizing feeling. I would agree with that word. So I think, but part of it is just like, maybe also a certain other vulnerability on our side of things too. From what I've kind of been able to tell with coaching so far, it's doesn't seem to be anything patronizing about it. It's kind of it's a program, if you will, or and it's a program that is kind of also wanting to witness your process as the one piece of the program is sort of talked about. So there's no presumption there.
Yeah.
I think maybe, partly that attitude on, if I could speak for my little part of the professional world, maybe that attitude that we feel, or this sense of patronizing that we feel, could be sort of dispelled somewhat if there was a way to get the word out more, that it's more about it's a process thing, it's a witnessing thing, and it's the process by definition means rolling with the punches as they come in. So
It's kind of a
I
wait
think,
and see.
yeah, so I think if there was a way to sort of get that point communicated better to us,
Mm-hmm.
there might be more of it would bring down that patronizing sensation that many of my colleagues feel, I think.
Mm-hmm. Yep.
That's out there, certainly. And just break down a little bit of that barrier, I think.
Okay.
If there was a way to get that point out there.
Okay, thanks for that. One of my presumptions, because my background is in working with traumatized people, especially traumatized young people, is there's something called complex trauma, and that is when someone's stuck in a difficult position for a long period of time. Some existential threats might be involved, and then there's no end in sight, and then you can sometimes end up with trauma symptoms. So my presumption is that some healthcare workers are going to experience that. I don't know exactly what my question is, but can you take that and run with it? So is that likely to happen in places other than New York?
Yeah, I mean, I think I was going to speak about New York, which the whole idea of New York from the Minneapolis perspective, I think, is also that I do feel like there's a bearing witness aspect to the news from New York, that doctors and nurses here are more in a position to bear, obviously, because those are our colleagues in New York. So thinking about complex trauma, I already think that whole phenomenon of bearing witness for our colleagues in Italy or New York already scratches the surface a little bit of what will come back to haunt us psychologically at some point down the road. But certainly, so I think that's already palpable here, and maybe fuels a lot of anxiety here amongst my colleagues and myself. On the other hand, from my perspective as a fellow colleague, I think those doctors in New York, those nurses in New York, really could have through that firsthand experience, they are vulnerable to some trauma in the psychological, psychiatric sense of the word, and certainly how they deal with that going forward, how that, might develop into chronic trauma symptoms, syndromes going forward. I think that's going to be a very real
Yeah.
situation in New York.
And we know that trauma is, circumstances are experienced by different people in different ways. So certainly many of the healthcare workers in New York are going to be none the worse for wear. They're going to be fine. And then many will be affected, but not affected greatly. And then you'll have some who are impacted greatly. I think that's kind of an assumption we can make. But
Yeah.
let's wrap it up here. Can you give me put a punctuation on this? What message would you put out there as a doctor
To the coaching community, or
coaching community and the community at large? You're seeing things from a really interesting perspective that kind of not put out there as much as you think it would be in these circumstances.
Yeah, I don't know. I mean, I almost, in a larger perspective, you can't help but think about our, highly polarized situation in general in this country. And, just, I think, just this whole opportunity, maybe that's just going to illustrate how we're all involved in this. And I think the physicians, trying to think, I might have to edit some of this later. I think it does. I think it awakens, in me anyway, it does awaken more of a broader community perspective on health. Of course, in complete contrast to our world only 2 months ago, 1 month ago, business as usual. Now we're in an actual medical crisis or crisis mode, and there's that sense we're putting ourselves on the line, but we realize other people are putting themselves on the line, and we realize other people want to help in a way of solidarity with this, like I think the professional community you represent.
I also see that there's 3 ways to approach this issue. And in the media, and I mean the full range of the media, not just the left, but the right as well, it can be approached as a political issue. And then it's also approached to a large degree as an economic issue. And then the third, of course, is the medical issue. And so it must, my assumption is that it must be hard when you see this issue being treated as a political football. And then, of course, there's the economic ramifications sometimes get put ahead of the seeing it as a medical issue. And then, of course, seeing it as a medical issue, which I'm sure you must as a doctor. Right. What's that like, seeing these other modes of framing the issues?
I mean, it is, it's been very complicated trying to piece your perspective, your professional perspective, your economic perspective, your own personal family perspective into this big narrative. I think to see it as a political football getting tossed around is kind of insulting, honestly, and that's like my own personal professional view, but I think many people are feeling that, because people know that the political football is mixing up all these issues and leading to snap decisions, or maybe not. So it's
interesting with Andrew Cuomo, the governor of New York. It's interesting to watch him be exemplary in many ways, I think. And one of the ones was he has to face incredible economic pressure on this issue, and he made it clear. I heard him speak. He said he made it clear that he's going to approach this thing as a medical issue, as a health issue first, and then an economic issue. And then he seems to be trying to push away the political aspects as much as he can.
Right. Yeah. I think the economic aspect is, obviously it's the political football getting kicked around right now. I mean, literally from my point of view, economic from whose standpoint, an economic issue for the 1% or the people who have something in this country or have enough in this country versus the economic issues for somebody working job to job or multiple jobs or however with a lot less safety net, you know. So yeah, it is an economic issue, and it's I get my heart lies with the second category, you know. But
All right, Scott, I'll give you the last word. How would you like to? I will give you the last word, Dr. Nelson. And I don't know, not necessarily what would you say to coaches, but I would imagine it's pretty much just Monday morning, you're going to get up and get dressed and go and see what happens. Something like that.
yeah, something like that. You know, and I think that's why too the coaching work that you and I have done so far, and just some of the discussions on projects like this, you know, I think that's stuff I need personally to, you know, I was kind of something also I'm putting on, just like I'm going to put on my scrubs and go to work Monday morning, you know, it's something that's a helpful element. So I hope that, I guess for you, like for your profession, I hope you guys can just find the message to and make clear what this is about, coaching, and to make clear that it's a process where you're there for the process. You're offering the tools that people have studied and come up with to kind of deal with these things, and that's what it is. You guys don't have an answer, but you have a process, I think, and that's what's important. So.
Well, I know it's kind of worn out thing to say, Dr. Nelson or Scott, but it's I sure appreciate the fact that you're going in and doing the work that you do and your colleagues, and so thanks.
Yeah, thank you. Yeah, thanks for reaching out to me and then you and your colleagues to us. I think it can be helpful, and especially in this moment.